is Fasi Mehta. I am the Program Manager at the National Incubation Center. And today we are going to be discussing a very interesting topic. But before I delve into the detail of the topic and introduce to you our panelists, I would also like to mention that this is a joint collaboration between the United Nations Development Program in Pakistan and also National Dialogue Forum. And National Dialogue Forum is a progressive public policy organization based in Islamabad. Youth development is a key area of focus for NDF, and they partner with UNDP and many other organizations in various initiatives focused on youth engagement in Pakistan. Before I also go further, I would also like to tell you that we have a team of sign language interpreters online during this webinar. And we have 3 people. I would like to mention them: Ali Raza, Anam Parvez, and Shazia Anwar. From time to time, one of them will be interpreting the session. And those of you who would need the assistance for sign language interpretation, please switch to gallery view so that you could see all of them. And then you can also see the person who is interpreting. And this is a team from a startup called DevTalk, which is also coincidentally an NIC startup. So congratulations and thank you for joining us and for your services. So moving on, the topic is actually quite interesting, but I would also like the UNDP's Assistant Resident Representative, Amir Guraya, to please come and share his views on what the program is all about. And then I will delve further into the topic and also introduce the panelists. So over to you, Amir sir.
Thank you, Fasi. Thank you very much, all panelists, Laura, her team. I think I know most of you, of course, Fasi and Fasi's, both of you, and I can see Shariar, Humaira as well. And of course, thank you very much, all of you, to be on the panel and support UNDP like that. I think I won't be long, although this is a very interesting subject that, about the fake news and how, it plays an important role in these circumstances, and especially when we have COVID on our hands. UNDP and National Dialogue Forum have, like all of you know, have assembled a panel of academics, media experts, government reps, and development practitioners to share their thoughts on the topic and respond to the audience questions. It is a privilege for me to be present among you today to discuss opponents and narratives around geopolitics or historical events. And there are people with whom you talk and they know that no news is bad news. So sometimes, the fake news is just not researched or well researched or well thought of, that they are, you see, but most often they are reflections of people's biases in the absence of accurate information. And, it's very difficult to help individuals and groups to make decisions, especially, in the rapidly changing world around them. The spread of fake news and conspiracy theories during COVID-19 through digital and social media is unprecedented. I mean, all of us, I would say, are affected by it, despite the fact that a lot of us understand that this is very, sometimes it doesn't make sense, but somehow, the visual way of transmission of the news is affecting us. And also, it sometimes so happens that fake news comes from a credible source, and then it becomes all the more difficult, to combat that element. The WHO has repeatedly used the term infodemic, to refer to the dissemination and amplification of false information about COVID-19 cures and causes in the wake of this pandemic. These disinformation or misinformation campaigns threaten individual lives by peddling quack remedies and unverified treatments, and create an environment in which xenophobia, hate speech, disruptive political forces, they actually thrive in these circumstances. And actually the disruptors, if I may say, are looking for this kind of an opportunity. It wouldn't be an exaggeration than the virus itself sometimes, So, as in the other parts of the world, Pakistan is also dealing with the social and political implications of disinformation and misinformation about COVID-19. Uh, our country has more than 37 million social media users who are directly or indirectly relying on platforms like Facebook, Twitter, and digital news outlets as primary sources of information. A lack of oversight over information dissemination on these platforms means that unverified information building on people's biases can be shared without consequences, without any accountability. This is having adverse impact on the government of Pakistan's effort to promote social distancing and responsible public behavior during this, I would say, the pandemic or the national or international emergency we are going through. However, every challenge, it also brings opportunities for improvement. In my view, the development sector can play a very important role in devising effective responses against the infodemic through awareness raising and strategic comms. This can also be an excellent entry point for expanding the development sector's role in digital peace building. On a wider scale, the pandemic can spur much needed conversation around the role of social and digital media in disseminating unverified or accurate information and offer opportunities for course correction for the state. And of course, also, I would say for the development sector and to focus more on substantive issues. I'm very pleased to inform you that Youth Empowerment Program's ongoing work to promote social distancing and responsible public behavior during COVID-19 through social media messaging by our reputable, partners and, clerics is gaining considerable traction online. Videos have been shared approximately more than 200,000 times and generating constructive debates about scientific and religious perspective on this issue. Furthermore, youth empowerment programs work with more than 40 mainstream and digital media journalists in Khyber Pakhtunkhwa is helping to create an informed media narrative about COVID-19 in the province and its effects on the vulnerable populations, especially in Khyber Pakhtunkhwa. Once again, I'm very grateful to NDF for assembling an impressive mix of national and international subject experts. And thanks to all the subject experts as well, the development practitioners to lead the discussion, and to the panel members for taking the time out for their, from their busy schedules to be here today. As always, I'm also grateful to our partner DevTalk for providing interpretation services for this webinar in order to ensure that more people can join the conversation. I'm really looking forward to an interesting discussion ahead. Thank you very much, and over from my side. Thank you.
Thank you, Amir. So without further ado, let me start by introducing the panel, and then I'll go further into this very interesting discussion. So today we have a great mix, as Amir also pointed out, in terms of professionals who have a great deal of expertise working with governments on various forums. So first of all, thank you for joining us, all of you, and thank you, ladies and gentlemen who have tuned in. We would be entertaining question and answers towards the end of the session, but this does not mean that you cannot put them through. So you can type it in the Q&A section and we'll entertain them towards the end of the discussion. We'll keep 10-15 minutes for that. So we have today with us Dr. Lisa Schirch. Thank you, Dr. Lisa, for joining us. She's a senior research fellow for the TODA Peace Initiative, where she directs the Institute's social media, technology, and peace building program to study the impact of social media on conflict dynamics and to encourage civil society movements for using peace building skills to address social media threats such as disinformation, something we'll be talking about, hate speech, and digital harassment. Dr. Schirch is also Senior Fellow with the Alliance for Peace Building and Visiting Scholar at George Mason University's School for Conflict Analysis and Resolution. She taught in the Graduate Conflict Transformation Program at Eastern Mennonite University for 23 years. Welcome, Dr. Schirch. And then we have in our panel, Humaira Mufti. Humaira, she's a career civil servant with over 24 years of experience of working with the government of Pakistan at various senior positions, including working for the National Journal for the Strategic Communication and Legal Affairs at National Counterterrorism Authority, or also called NECTA, and also the Deputy Permanent Representative of Pakistan to UNESCO in Paris, Joint Secretary Aviation Division, Foreign Trade Wing for Ministry of Commerce. Her contribution towards strengthening of internal security framework and international implementation of the National Action Plan to counter terrorism and extremism are very well recognized. Uh, Humaira is basically a strategic comms expert on counterterrorism matters and looks after various activities in that sense. So we will be tapping into her expertise in a few minutes. We also today have with us Dr. Umar Taj. So Umar is the founder of Najathon, a crowdsourcing platform in which diverse teams of stakeholders come together to find behavioral solutions to social problems. A very interesting topic to talk about today. He's also the founder of Behavior Insight, a tech-based behavior change solution that systematically identifies barriers to behavior change and guides the user to develop successful interventions. He delivers regular training and facilitation workshops across 50 global institutions. He holds a PhD in behavioral science from Warwick and an MSc in decision sciences from LSE. Thank you, Umar. Thank you for joining us. And we have people who have joined us from different parts of the country and also otherwise from the world. So from US and from UK. Fasi now, my namesake, good fellow, great friend. Fasi Zaka is a Pakistani political commentator, columnist, strategic comms specialist, and has worked in the realm of policy, public policy and communications with various government development sector stakeholders. During the COVID crisis, he's also done extensive work in developing communication campaigns around the issue. Fasi is also, by the way, a Rhodes Scholar. And Fasi Zaka shows, also runs radio shows on FM 91 and also actively writes and also runs podcasts. So we will be tapping in to hear actually how his comms expertise comes into play when curbing fake news. Sadaf Khan we have with us. Thank you for joining us, Sadaf. Sadaf heads the Media Matters for Democracy, which is a local NGO involved in the promotion and protection of digital rights in Pakistan. Media Matters also trains local journalists to develop data-informed and fact-based stories on development issues in Pakistan, including COVID and its impact. Thank you so much, all the panelists, for joining us. So fake news, while everyone was talking, and Amir also mentioned that why fake news spreads. We'll talk about that. What is the need for fake news to spread? Why do we share it? But during crisis, what happens is that the timely dissemination of information is very important. And it's a coordination during any crisis, whether it is a health crisis or a natural disaster. And when it's what happens is if there is no authentic source, because people are afraid, perhaps they share anything that comes their way with this in mind that they may be saving someone's life, while this is not often authenticated, whatever the information is. What we have seen since COVID started has been numerous cures, numerous tricks, numerous hacks to do at home, and also many other news associated with multilateral organizations, with government in terms of availability of a particular medicine or not. So let's start with this, that what are the various ways? So in today's time, social media indeed plays a great role, but there is a traditional media, there is a one-on-one interaction which is not happening. So what are the various ways that fake news is spreading and how social media platforms can regulate this? I believe we've seen certain regulation measures being talked about in Pakistan as well, recently at a meeting of led by the NCOC. So we'll talk about that. And the important part, is it even possible to regulate? Because where do you draw the line between free speech and freedom and then curtailing such news? So let's start with you, Dr. Schirch.
Okay, thank you very much for hosting this, this forum today for us to talk about this dire problem. As you know, here in the United States, where I'm located, we have a tremendous problem with COVID-19, with over 60,000 new cases every day and many, many deaths. Let me just start by saying the scope of the disinformation. So the University of Oxford looks at all the different information and declares that 2/5 of all COVID-19 information is fabricated, it's made up. So 2/5 of the stories that are floating around specifically on social media are false. And another research, documents that there's 55 private Facebook groups in Europe and the United States spreading false, dangerous information about masks not working or telling people not to wear masks. So the scope of the problem is huge. There's a variety of different motivations for why people are spreading this disinformation. I would say most of it is politically motivated. So we'll talk later this morning, this afternoon, on terror groups and specifically anti-government forces that are trying to undermine governance and legitimate authority. But there are also strange, what we call them clickbait motivations. Literally, an investigation found 2 high school students in Congo, in DRC Congo, making up disinformation stories about COVID-19, spreading them around purely for people clicking on them, and the ad structure of social media will then reward them, will pay them for every time somebody clicks their story about some crazy source or origin of COVID-19. And so that's a purely economic motive. They're actually having fun and they're making money spreading disinformation. So what is going on now in the research world are people are trying to trace down all the different sources of who is creating this disinformation. And because really the technology companies need to be stopping this, and they need to be pouring money into the investigation into who's spreading it. Most of us who monitor the technology companies say they are not doing enough. We tell them about conspiracy theories and fake news and the danger of it to people, that it's causing people to lose their lives because they're not wearing masks or they're not taking social distance carefully. And some posts come down, but many of them still continue about the 5G networks, which again, we'll talk about later this morning. So I think you've mentioned already in the introduction, we do need regulation from technology companies, but the thing that I think is most important is digital media literacy, where the public, where civil society becomes more aware of disinformation, the motivations behind it, and starts fighting it. Because in Latvia, Lithuania, Ukraine, they have civil society, they call them armies, cyber armies of elves that are undermining the trolls. Often in their case, it's Russian disinformation, but they're really, civil society is empowered to understand how to identify it and prevent it. Thank you.
Thank you, Dr. Schirch. So let me ask you the same thing. Sadaf, you also work in that space. What do you think are the ways to regulate it? And any other example you would like to narrate or share where it has been done effectively yet?
So I think, as you mentioned earlier, regulation of any content online is a very slippery slope. And once you start bringing governments in, you don't know where that regulation is going to stop. And specifically in Pakistan's context, what is declared as fake news. We know that the Ministry of Information right now is running a Twitter account called Fake News Buster, in which everything that goes against the government's narrative is marked as fake news, flagged as fake news. So in countries like ours, where rule of law is not, ideal, and abuse of power is common, and the understanding of civil liberties such as freedom of expression, right to information, and privacy itself, these are contested areas, and seen even, unfortunately, within the parliament as Western concepts. Talking about regulation is going to be difficult. We have an indication of what it would look like because the government introduced Citizens Protection Against Online Harm rules in February, which give the control to a singular person, the national coordinator, who gets to define how all these terms will be experienced by the government, and then regulated or taken offline. So the danger of focusing on regulation as a solution to misinformation, that's high. I agree with Dr. Lisa that digital media information literacy, that has to be our prime goal. However, how we get there, that's another question, when the government is actively trying to undermine users of social media and trying to create an environment where singular narratives, where dominant, where a hegemony of narratives is being created, so to say. In terms of technology itself, we do know that misinformation, specifically in Pakistan, WhatsApp is one of the primary tools through which misinformation is being spread, and that brings another question of regulation. If the majority of forwards which are spreading dangerous information are going through a platform that's not social media platform, that's a communication encrypted platform that's closed, through to which even the technology company technically doesn't have access to, then how do you really regulate? What do you ask for? And how do you counter it? So then again, civic responsibility becomes a huge issue. People who are from Pakistan, you and I, we see the majority of this fake news thing flowing through family WhatsApp groups where our elderly are present, people who do not have the technical advantage to understand how these things are created and who fall for it. And yet we see younger people who might be better aware not bothering to say, no, what you're forwarding, it's this forward message is not authentic, it's not correct, it's not. That conversation around how information is constructed online, that's not happening across social structures, across social classes, and across generations. That's where I think the intervention would come in, if any effective intervention is there. Regulation itself, that's a very dangerous thing. We're seeing in Bangladesh with the new laws, everything that's critical of government is being branded as fake news, and journalists are being picked up and arrested. And similar stories are happening across the world.
Wow.
So that's one route that I don't think is going to lead to anything. We have to link everything back to digital information literacy, and we have to empower civil society to take a stand against fake news. And we have to take the power back from the governments to define what's authentic and what's not authentic. The fake news buster type elements, and that create a very dangerous situation in which public doesn't really know who to trust and who not to trust. So I know there are lots of people, so that's why I'm keeping this.
Thank you, Sadaf. Humaira, you're working with the government, you're working in a role where such issues often pop up, and what kind of angle to take, what is the right connotation to use in terms of the comms elements. When traditional media often report something which is fake, they face sometimes the wrath through camera or other organizations, but often it comes to the fact that how the government is authenticating something as a verifiable piece of information which spreads out. So what are your comments on this? How do you think, what is it that government is doing in terms of regulating it, how to control the spread of fake news?
Well, fake news are not something new. So we at NACTA, we were looking at the role of fake news in creating a security situation for the country. For example, the terror groups would use disinformation campaigns to not only recruit more terrorists and get the funding. So at NACTA, we launched Chaucus app where people could report the content. Then we had another application which was SurfSafe. So through SurfSafe, you could, it was actually meant to build a crawler. First, the idea was to build a crawler where it could take down the hate material and the content which is leading to terrorism. For example, use of black flags by the ISIL, and then the seal of Prophet Muhammad. So they basically combined the hadiths of Prophet Muhammad ﷺ towards the end of time. So it's a very smart maneuver where the terrorists actually use the ideology which is widespread, which has widespread acceptance, and then they make narratives around it. So when you look at this COVID-19 and the the spread of fake news, I think the world was shocked by the event itself. So the response from the authorities who were supposed to give the correct information, it is basically the responsibility of the government to bring forward the facts. The more delay when it happens, and the more misinformation and disinformation campaigns are launched. So it's the first responsibility is that of the government, and then the civil society and the people on how they accept or absorb that information. Not only their level of literacy, but also their level of immunity, how much immunity they have to such information. So when I was working at NACTA, and even now when I'm advising UNODC on the strategic communication side to create resilient societies who are not easily influenced by the narratives of the terrorist organizations. So there we have to design, design programs where you create youth who are resilient. And because they are the majority of your population, they are 65% of Pakistan, and look at the age numbers. So if you look at the numbers, we are targeting more in terms of terrorism. But when you look at COVID-19, it engages the whole country, any campaign. So how to ensure that your youth is part of your, how do you say, campaign to ensure that fake news are not spread. So you need that. I agree with Dr. Lisa. She said that there are countries who have cyber army where they participate on behalf of the government, and Twitter, where almost 6.9 million fake news were blocked. But they were not blocked in a way where people could not access them. People were still accessing that information, the fake news, and it was spreading more. So for us who are working in the security domain, I think the impact of fake news is far more dangerous and serious when it comes to terrorism and extremism. I will address the issue of COVID-19 later, where it has further affected the fault lines in the country.
Sure. Thank you, Humaira. So let's ask the same thing from you, Dr. Umar. In your experiences, you are very much involved in behavioral sciences. What nudging does it do for people? Why are they so convinced to share? And what is the way to regulate? Can nudging be a way to help curb the spread of fake news?
Sure. So when thanks a lot for having me in this conversation. When I was thinking about this, I thought, well, what does behavioral science say about things? And I thought they nicely fit in three different categories. So one is, well, why would we share this stuff? So I'm not talking about the creators, but I'm talking about those. Why would we want to share any content that might not be true? And the second is, well, why would we then believe in it as well, right? And then the third is, well, what is there something more innovative behavioral insight solutions that have been tested out? And I think during this conversation, I can talk about that. So maybe start with the first thing, which is why would we, at the end of the day, the fake news, there's just two things. One is more people spreading, but then also people end up believing the news, right? Well, that's probably why it is a problem. And comes the basic question, which is why would we believe in something like this? And it goes to just how our brain is wired. And it's going with this idea of this dual processing system that we have. So think of them as like two characters that we have in our brain. A really simple way to explain that is, if we ask people what's 17 times 33, and nothing really comes to mind except that, oh yeah, it's a multiplication question. If I have enough time, I will be able to come up with an answer. But then here's another one, which is, if I tell you all that, and it's a really famous problem, a bat and a ball costs 110 rupees, and the bat costs 100 rupees more than the ball. How much does the ball cost? And for many of you, the answer that pops up is 10 rupees, right? Which is the wrong answer. In fact, I actually asked a national sample of Pakistan, around 2,000 odd nationally representative sample, exactly this question, 95% of them got it wrong. They said 10 rupees. Right? It's a really simple thing, but it illustrates this point about there's this one part of our brain which is acting very fast, unconsciously. We don't really have control over it. That operates almost 95% of our time. And then there's this other part which is more conscious, more deliberative. That's what we call the slow system, the more thinking system. But that's only operating 5% of the time. And when it comes down to believing something, we think that people are alert, which means they're using their slow system, also known as system 2, and that's why they would take it in and stuff, but that's not the case. It's this fast system that's operating. And for this fast system, the story is really simple. One, it loves stories. Second, as long as the story makes sense, irrespective of the quality and quantity of data, it's believable. So this fast system, which is operating most of our time, anything that is believable, it sort of makes sense to us. We're going to say, yeah, makes. Now, the way it should happen is that the slow system should monitor. It should keep a check and say, hold on, just pause, wait, look, right? Which is what a lot of our solutions are like, right? We give training and we are saying, how can we pause something, etc. But that is lazy. It doesn't want to work. And that's one big reason why we would end up just taking it in, because yeah, it makes sense, right? I mean, and hence we go with it. The second thing is around this, we call it the confirmation bias. It's just our tendency to look out for information which already goes with the existing beliefs that we have. And this is where social media exacerbates the problem just based on its algorithms. Why? Because you engage with things that you're interested in, and the more you engage, the more the similar information is presented to you. So you get into this vicious cycle in which you keep on going extreme and extreme. And there's a lot of work done on group polarization, where as you hear and see more information which sort of fits what you already believe, you then keep on believing it more and more, right? And you keep on. And the last one on this, which is I would believe, is who is the messenger? Right? Just COVID specific, I've asked it in 3 different national surveys now. Government is the least trusted source when it comes to COVID measures, right? Who's number 1? Doctors are number 1, right? We would take a message, we would believe a message based on who we would trust. And what determines that? It determines whether that person is a source of authority or not, or do I take that as a source of authority or not? Do I like that person or not? Are they similar to me or not? These are the things that would influence the power of that messenger and the power of that message. And that would then it would determine whether I would believe in it or not. So I'll just stop here onto this bit, and maybe later I'll share about why we would share stuff as well. But in terms of why we would believe, I would say it's just the way brain is wired. We love stories. As long as something makes sense, why not? We only seek information that confirms our beliefs and who the messenger is.
Okay. So, Fasi, if someone is sharing because they believe, they want to believe, they tend to believe, it's a knee-jerk reaction, as Umar says, instead of a more cognitive approach to it. And we've seen how the panelists have shared their views about how best it can be regulated. Is banning anything in Pakistan a norm? What can't be regulated, ban it? Is that the right approach? Or what else are those approaches to regulate it? So let's hear your views on that.
I think banning wouldn't necessarily make the problem go away. One of the problems that we have is that we also suspect who will be banned and for what reason, and whether there's a fair possibility for appeal, because these things tend to start getting some degree of mission creep. They start for one purpose and then encompass into a whole lot of dissent in other areas as well. I think in the case of coronavirus disinformation, to a degree, one of the problems is that politics has caught up to social media, where politics is now, a decade ago, social media had already begun. We've seen the rise of far-right nationalists all over the world, and one of the key things that they've done is undermine expertise or people within the old guard and structures. And so when you're looking to have something like a public health crisis, that's an automatic area where you will also start to exhibit a lot of doubt at a time where it's incredibly necessary. I also think that part of the problem in the COVID case is some of it's natural. If you see the evolution of information that's come out from the WHO, it's changed over time as they knew more about the disease. Obviously, things that we've known about pandemics since 1919 still apply, but for a lot of people that is contentious because hand washing and maybe wearing a mask isn't as big an issue, but it's also correlated to a lot of economic issues which impact people directly. So there's also an incentive to disbelieve if some of the economic measures will be painful to them personally. I also think that one of the major things that we've seen from social media firms where actually more needs to be done rather than the government get involved is that as they've grown historically, they use the free speech narrative, which was really appealing, but it was also maybe made to prevent getting some degree of regulation. And now we're pretty clear that some degree of regulation is absolutely necessary, because where you have issues that can result in violence, or in this case, death or infection, these are things that can be controlled to a certain degree, which may not be that controversial. And these are things that at least these firms, if they were willing to self-regulate more, we'd have less of a problem than we do now. I also think one more thing is that part of the reason that you've got so much disinformation, some of it we've seen nation states are working against each other. Dr. Schirch has talked about that. Even the US is putting an emphasis on the source of the virus. And a lot of nation states are getting involved in something like this. But when the virus came out, we heard this thing that this is a disease that doesn't discriminate. Very quickly, we found out that it does discriminate. It affects the poor more, people who can't socially distance. And also it discriminates in the sense where there is polarization already existing in a country, or there is severe inequities. This is also playing that up. So racism against Muslims in India was not created by the coronavirus, but it became just one of the excuses to latch onto. The same is the case for sectarian issues in Pakistan that were ascribed to the coronavirus. So in some ways, I just think that some of what we're seeing with the coronavirus isn't a coronavirus problem. It's our long-standing structural issues that are just being raised by this.
Thank you, Fasi. So this is quite interesting. So what I'll now do is I'll ask questions. I would respect that if you can give short, quick answers so that we can ask more questions, probably to have better perspective on a lot of other things that the fake news theories involve. So what happened is that earlier some doctor from UK went on to say that there is this herbal tea that you drink, senna tea, olive tree leaves and what else, and I'll give 20 million rupees worth of, to anyone who says that they've had it and they've not been cured. And then came these, self-administered COVID tests, and then came holding your breath for some seconds, and you can test whether you have COVID or not if you cough. And then came the news of smoking and the use of tobacco to be increased. And then came the news that probably tobacco industry is doing a propaganda to promote their products in this time. And hence shisha and those people who are having shisha or who are smoking are not getting sick. So it kept changing. And similar was the stance by many organizations because there was not enough information about the virus. And since it is an RNA-based virus, so people were knowing. So the stance from WHO and other organizations was changing. As more and more developments were coming, more information was coming. What is the reason that this spreads so quickly, so easily, and we all like it that, let someone be cured. Everyone would share on WhatsApp. You were referring to this being a problem of young people. Elderly people do that because they think they're probably taking care of their loved ones while spreading this news. So my question is to Dr. Schirch to start this with, that what is the role of fake news and conspiracy theories especially with the local political agendas, as you pointed out, as Fasi just pointed out, and others. So what are those fault lines or social fault lines, if I may? And we've seen, the Shia Sunni and Tablighi Jamaat being accused of it. Similar example that he gave for India. So why do we create such news, whether it is the quick recovery ones or whether it is that attaching the sectarian ones? And how is it best? What is that solution? I know it's a long question, but what is the solution to curtail it? What is the role that the people can play not to spread it further?
Okay, that's a big question. Thank you. So I'll talk mostly about the United States because I actually think that the dynamics in Asia are very similar in terms of our white nationalist, white supremacist groups here in the United States, seeing this as an opportunity to further polarize our society. Obviously, the US, we've had polarization and division for many centuries, actually, because of slavery and the civil rights movement and the ongoing struggle for racial justice here. So now white extremist groups see it as an opportunity to further polarize people. So they are actively spreading disinformation to the anti-vaccine, pro-holistic health community about, miracle cures as well as anti-vaccine messages, because they're trying to draw in that crowd, the anti-vaccine crowd, which is also often concerned about healthy eating. So it's not all terrible stuff, but they are directly sending messages to that community to try to pull them in. The other community they're trying to pull in is the anti-technology. The people are concerned about 5G networks, and they were concerned about this before COVID-19, but now they're piling on these stories, and the things that were small divisions in society before, they're creating a unified narrative that the pandemic is allowing them to get away with. That as Dr. Taj said, it's compelling. People are anxious, they're depressed, we have no ability to figure out our future. People are clinging to any sort of simple answer. And extremist groups often come up with these unifying messages that pull together really diverse concerns into one big conspiracy. What can we do about it? I think the countries that are doing the best job have a very strong health sector that is putting out information every single day. They do a webcast, they talk to the public, they explain the latest research, they give the guidance, they give information. Here in the United States, in New York, for example, the governor was giving public addresses every day. Very compelling, people were watching, and it is the most effective thing, I think, to combat this information. Not all countries have a health sector that can do that, and that's what we're trying to figure out now in terms of the development agenda for UNDP and USAID and others. How can they get that authoritative health voice that is separate from the government? As you see in the United States, our health sector is at odds with our government. The president undermines the Center for Disease Control. So that's partly why we have such chaos here. Thank you.
Thank you, Dr. Schirch. So, Humaira, your points, what can be done for controlling this menace in Pakistan? And what is the government's plan around it? Great thing that Dr. Schirch said is more communication. I believe you guys are already doing that. Every day there is these news conferences happening.
Well, I think the guideline was given to us as Muslims 1400 years ago by the Prophet Muhammad sallallahu alaihi wasallam. He said that don't forward the news a lie, like if you without investigating. Don't forward the news without investigating. So he said, Urdu mein I will say, किसी शख्स के झूठा होने के लिए काफी है कि वो हर सुनी सुनाई बात को आगे बयान कर दे. It's enough for us to realize that a person is lying, that he's conveying the message of somebody else without verifying. So how to develop the ability of youth first to verify the news that they are receiving. So I talked about creating the immunity among the youth from extremism and terrorism. Same is the case that you have to develop the immunity among youth to against fake news. So how it is through education, through teaching them ethics, through teaching them how to sift right from wrong. And it's not necessarily through the educational curriculum at schools. Education can be done by the media, by the social media platforms, by reliable people like you, Fasi. You can think of something creative where the youth is trained to see through things. I think Nordic countries set a very good example. They have established a system where they are training their youth to sift through the information that they are receiving. And Umar said something really amazing, which I experience every day. If I search something and then I'm swarmed by information. For example, for me as a counterterrorism person, I have to look for narratives. I have to look what other countries are doing. Then I start receiving strange kind of messages on my mobile and my laptop, which I don't want to see. So it's really, I seriously, I never planned to join Al-Qaeda or ISIL, but still you are bombarded with information that you really don't want to get involved with. So what government can do is that government, first, we were thinking of putting crawlers by PTA where you can take down the hate material, but I think it will affect the freedom of expression in the country. And also where we launched this app, Surf Safe. Who will look at the content? Because you can have the data mining thing done. You can have I think technology people are more aware on how to sift through data, but for the government, it's an expensive exercise to undertake, to take down the information which is not true. So I think the responsibility lies with the social media and the big Facebook, Twitter, that they should establish internal mechanisms where the information which is reported as fake, sometimes they say it's not representative. So I think for issues like health crisis like COVID, there are systems that they can put in place to control spread of fake news.
Thank you, Humaira. So, Dr. Taj, I'd ask you this. So, when something trends on Twitter, and if even you put up a counter narrative, even if, for instance, I shared something which was trending, and now the counter narratives had taken down the trend, and I've shared that piece of information on WhatsApp, it has gone viral already. And from WhatsApp, it goes into conversations over SMS messages. And many people in Pakistan were not online, whether from the remote areas, where rural areas. Someone put in a question that many of our religious leaders or people who are very practicing Muslims are not very much aware or very confident that this even virus exists, right? And that source, which was once probably a fake news, has been taken down, but is still spreading. A good part both said that in lots of awareness campaigns to train the youth and lots of communication by the government to make sure there is one authentic source. What else do you think can be done to control this spread?
So I think one thing which it's important is that, so there was 2 years ago, a paper published by researchers at MIT, where they looked at 11 years worth of rumors spread on Twitter. They looked at around 126,000 rumors, 3 million people, and they saw how it spread. And lies spread faster than the truth. Right? Which means there's what is inherent in the fake news that makes people share. So one thing, all of our efforts are on debunking. So one, I think we have to go on pre-bunking, right? Which is somehow we have to stop the person reading it, let those beliefs get rooted in their mind. Once they are there, sharing any counter narrative is not as productive because the effect has already taken place. So at the moment, a lot of efforts that we do are debunking, and giving information, which we know we're trying to target the system to, slow thing, but that system doesn't really operate in us. So we have to somehow get into this fast thinker and somehow train that fast thinker part of our brain to. But I think the thing is, why would people share? Because I think this is an important question. Right? Why would we want to share this stuff? So I would just share like 3 things on it. One, and there's a lot of work again done on this. There's a brilliant book I would suggest people to read. It's called Contagious by Jonah Berger. He's a professor at Wharton. He's looked a lot into, well, what makes things go viral. And there are 3 things for fake news, especially, which I think are important. One, it's something called social currency. What we would share stuff that would make us look good in the eyes of the people with whom we have shared it. It's some sort of a status. So social currency is that one thing which makes people spread something, right? If I share something, if I share a cool cure for COVID, it makes me look good, right? And I gain this social currency. The second is stuff that goes viral elicits some sort of an emotional reaction. It would be fear, it would be anger, it would be joy, right? Disgust, anything that gets this emotional reaction out from us makes it more likely for us to share. You know, you would see somebody tripping over, funny, shocking, however it is, we would share that. So generally, it's these fake news trigger greater emotion than the truthful news, right? And the third is this thing of practical value, where, in all honesty, so people would want to share stuff which they think can have practical value for someone else. So why are we seeing so many of these cures being shared, right? Because like a lot of people who would share would genuinely feel that they're helping someone else out, because they're adding this practical value to someone else's problem, and therefore you would share it. So these 3 things make it more likely, and somehow I mean, that's the whole thing. Within fake news, when you're creating it, you that's what you see. And in that study, the 3 million, so there are 126,000 rumors. What they saw was predominantly lots of emotion from this stuff, from the fake news that was there, and this kind of some value that's in. On solution, so I'm going to put it out. So this is something which is currently, there have been a couple of studies done on this. This is like more this thing of pre-bunking around training you. And this, I would put it under an innovative BI, behavioral insight solution, or a nudging solution, where the idea is, again, on inoculation, where you give a vaccine to people to cure this infodemic kind of a thing. And the way that they do that is it's a game that you have to play. It's active learning. I'm sure you will have lots of objections to this, fair enough. So this was researchers at Cambridge who did this, in which in that game, your task is to use the techniques that are being used to generate fake news. So it's a low dose vaccine in which you have to create, you will gain points actually if your fake news sounds more credible, etc., in that game format. But somehow, by these players using techniques which are out there, people know these techniques, but by using them, this was with the 15,000 people that did, it actually made people recognize, after playing the game, the source that was more reliable, so messages that were more reliable. So I think somehow this kind of an active learning inoculation against fake news that's one thing which, from the behavioral science domain, that I know has been shown to work.
Thank you, Dr. Taj, and thank you, Sadaf. You're sharing some valuable information. I just saw the video clip on the 7 tips to identify misinformation and disinformation online, also specific to COVID. Thank you. I would encourage all of my audience attendees to please do look at this information. Valuable. Thank you. Let me ask this question to you and to Fasi as well. Then, that we talked about political motivation. We also talked about many right wings getting active. We also talked about how different countries reacted. But in case of Pakistan, the state-society gap, which is now ever widening because of the spread of perhaps these fake news, mostly, yes, in some cases are politically motivated. But in COVID, whether it was the government is not responding enough, whether it was the government is giving fake figures, there's less testing happening while everyone is putting out the test data, and that there is nothing in the rural sector, It's only an urban phenomena, maybe because people are not moving around. And then came this whole social unrest and anarchy that, and huge fake news conspiracy that government gets money on every death that is happening in the country. And the government is being paid by a multilateral organization and funds and dollars. So such fake news spread far quicker, as we all just discussed. So what do you think? How can one highlight that this is a politically motivated agenda behind this? Perhaps you could also share a brief insight of this content also that you shared with us that can help in identifying that this is fake and this is politically motivated.
So thank you, Fasi. I think the main answer to your question would, like, if you think back to the first press conference our Prime Minister held on COVID, the first thing he said, it's just a flu, it's exaggerated, and if you get coronavirus, nothing will happen. You will fall sick for a few days and then you'll be okay. The misinformation that you pointed out of the government getting money, the $3,000 per patient that the WHO is supposed to be paying, that came from a PPP not parliamentarian, but Nabil Gabor Saab, one of the most well-known politicians in the country. The kind of misinformation that Dr. Lisa was pointing out that relates to the health effects of it, that has come through various government designatories. I remember the governor Punjab, for example, he said that if you start drinking hot water, the virus will transfer from your lungs to your stomach and then your body will pass it out and you'll be okay. This is a minister. Then the whole thing about Sana Maki and all the herbs that we're supposed to be using, that has also come through different government ministers, including the president himself. Multiple cabinet members have retweeted propaganda accounts spreading misinformation. And most
those
important,
chlorine gates, the gates spraying chlorine on your body forcefully,
yeah,
disinfecting
exactly.
you.
Not just that, they have mocked people who have been following SOPs. One of the parliamentarians stood in the parliament and said, if people who are scared of coronavirus, if you are as scared of your God, you will not be doing corruption. So essentially mocking people who are wearing masks. And then there's like even more dangerous, what you're talking about, political agendas. You just, in your question to Humaira, you said there's somebody holding a press conference every day. If you start looking at the press conference, I think 80% of the press conference is about what a different province or a different district is doing wrong in management, rather than what they should be doing or what the COVID is about. So there is no public engagement by the government about the spread of the virus. We are not treating COVID on media, at least. The government is not treating it as a health emergency. They're treating it as a political emergency. And from different, like take the federal government and the SIN situation, the PPP versus PTI situation, every politician who's on air is essentially trying to discredit what the other politician is saying. And as Dr. Umar was saying, his surveys have consistently showed that the government is the least trusted information source at this moment. But the thing is, the government might be least trusted, but the workers of different political parties, they believe in what their political party leaders are saying, maybe not as a government, but whatever they're saying, if they're discrediting the lockdown, then people are actively going out saying our leaders are opposing the lockdown. If a PTI MPA says that the Sindh government is falsely exaggerating figures, and we actually visit the hospitals, there are no COVID patients, then people do feel that perhaps there is a foreign agenda involved, the whole Bill Gates conspiracy and US trying to sterilize people conspiracy, then that gets strengthened even when government doesn't say it outright. The confusions that they create in people's mind by saying all these things, by being irresponsible, by going on air without masks. I think our Prime Minister has finally started wearing masks only three conferences or so ago. But by giving this attitude that everything is exaggerated, and by at the same time discrediting civil society, because it's not just happening that you are not saying something, you are saying everybody who's saying this is an alarmist. Everybody who's saying this is essentially serving a foreign source or something. So you create an environment where you are not giving the right information, and you are putting the credibility of people who are questioning your narrative at risk too. So where does the public go then? And that's where what Dr. Umar was saying comes in again. People do, if that's the information I'm getting, if that's the information that makes me feel safer, I don't really know whether mask works or not work, and then suddenly there's this piece of information that goes some impressive sounding university which nobody has ever heard of, but has a very interesting name, and a panel of 10 foreign professors, and they have suddenly said that it's all okay and you're going to be okay. Then I want to be okay, and then I automatically think, okay, all this is just confusion, and but this is something credible, and this quote starts, and why would somebody be making up starts, and so you automatically start going into that direction. So in terms of what to do, I think the first thing the government needs to do is to stop saying these things that are false. Stop saying, Murad Saib needs to stop standing in the assembly and say, for example, that New York is going bankrupt, so they're looking at Pakistan to see how lockdowns have to be put in place, giving the impression that we have this sorted. The world doesn't have it sorted. We have it sorted, and the world is now following us. So it's okay. You go out and you do whatever. Then the second thing I think the government is failing it is picking up narratives that we as civil society can't. There are lots of sensitivities involved, religious sensitivities. For example, the Sana Maki and all the cures, they're most often being presented at Tibbi Nabwi based cures. And when religion comes in, people like you and me, people who do not come with religious authority, if we counter it in public spaces, then we stand at risk, unfortunately, given the society that we live in. So where is the government machinery, institutions like the Council of Islamic Ideology or whatever, the ulama councils and the religious ministry, in places where civil society is at risk with regards to countering information that has an extremist religious element brought into it, that can only be done through responsible governance. And that is what I see currently happening in public spaces.
Okay. So thank you so much for sharing this so candidly and openly, Sadaf. Really appreciate this and very important points that you highlighted. So Fasi, we saw that there was these, reconciliations. There were actually lots of consultative sessions with religious leaders, with leaders from different parties, and still we are in this whole chaos that we are in right now. Some reasons Sadaf has explained and highlighted. What do you think is a further role that can be done, and in terms of especially how to highlight that this is a politically motivated news and post?
So I actually think that I thought Sadaf gave a masterclass explanation of the whole politics of this and why this is a problem. And the biggest thing that we need to understand is that any campaign addressed at this will never supersede the political reportage that goes on every day and dominates the airwaves and actually forms opinions. And that's the fundamental problem that we have right now. If you look at the degree, there's been no campaign that we've had that we've been able to run on TV or radio that can sustain itself as 3 hours of press conferences every day and much more interesting political contestation between people. So that's one of the fundamental problems. I think Humaira's religious example was perfect. I think it's actually really powerful for a lot of people because we have to find different audiences and they relate to different hooks that they find credible. I also really found Dr. Umar's experiment really interesting. But I also think that one of the reasons this is going forward is that in politics, if you look at the history of political science, nation states have been built on hate and otherizing. They've been able to continue on that basis. And online also, one of the functions of these sort of rumors have is that they otherize other people, and that brings people together, oddly enough. Even as it brings people apart, it creates certain groups that you get attached to. And one of the things that is also possibly hard to compete with is conspiracy theories are very comforting. In a world that is so complex and uncertain, somebody tells you that this is what's really happening behind the scenes, that this is the person who has it out for you, this is the group that's kept you down. There is nothing more comforting than saying that as opposed to something like, well, we have a political system, it's gone and grown over the years and it's going to be hard and we need elections. It's just one of those things that has an innate appeal because it will transcend easily and it is something that people will buy. And also in terms of psychology, I mean, I find this really interesting. It's also going to be hard to appeal to people. There was this study that was done last year. It was fascinating. They did MRI scans of Lashkar-e-Jhangvi militants, and in Spain. And I don't know how they got them to agree to it. They were ex-militants, but they agreed. And they tried to give them messages on how to give up or renounce violence. And the prefrontal cortex was entirely empty. It was not even listening. Like they had trained themselves essentially that that part had shut down. The only time activity came in was when they said that an ex-colleague of yours, that means a trusted interlocutor, whose word they trust, said that maybe extremism is okay, but violence is not. And then suddenly, that's where the decision-making and the thought process started. Right now, at least for the religious element, we've seen that they've come together, but they have, like many of the political groups, also paid lip service. There is an agreement on congregational prayers. We've seen that it is not being followed. We're also seeing in polling that people continuously believe it's increased, actually, that they think the threat of the coronavirus is exaggerated. And the self-reported number of people going for congregational prayer has also increased. As far as just one that, Dr. Schirch said, I agree with that, is it's going to be a long-term process, and digital literacy, starting off from the beginning, is going to be incredibly important. Without that, there are a lot of means, but this is something that will be sustainable. And I think one of our greatest epidemics is that we've got a lot of old uncles who we really respect, but they've gone crazy. They were used to a world where there was a left-wing and a right-wing press, but the gatekeepers did their jobs reasonably well. Now they're getting information unfiltered, and now we're seeing that even they don't have the capacity to actually filter it out. So I just think that the key is long-term is figuring out how to get the basic tools of digital literacy out.
Excellent. Thank you so much. Very, very nice points that you highlighted, Fasi. As much as I want to ask lots of questions, the audience also wants to do so. So we have some piling up. I'll switch to these questions, and then after another 10 or 12 minutes, we will then summarize. So yeah, lots of things that you've already talked about have also shown up. Is there a way to stop misinformation spread by the government? So we've talked that government does lots of conferences and awareness campaigns, but what is the way that the government can do and stop its spread without curbing or banning or things? Humaira, would you like to answer this?
Well, I think Sadaf dissected everything pretty well. The government has first, in terms of regulation, when we have a law, for example, whether it's to protect citizens from online harm or Pakistan Electronic Crime Act, these acts, if they are, you have to see who is implementing that act. Which authority, under which authority? Is it FIA, is it NACTA, looking at the hate speech, or the Provincial Home Department? So you have to see the capacity to understand the content. So as far as the regulation side is, government is happy to pass legislation, which some organizations may not be happy with because of the way the law may be used or abused. And we have seen more abuse than the use of the law in this country. I'm not speaking on behalf of government. I'm attending this conference or webinar in my personal capacity. The other thing is that the government has to bring out the facts openly and have an opinion, or not the opinion, but must consult the doctor and the scientific community when it comes to giving out information on COVID-19, rather than having political views or do the political point scoring, which is not going to affect, which is not going to have a positive impact on the health of the population. So it's better to do justice when it comes to COVID-19, and they have to give the true picture to the people and not give multiple opinions and conflicting views on COVID-19. And surprisingly, though we are a nation which is not very careful, I've seen that the spread of COVID is lower as we have seen in Europe and in United States, it's not as bad. I've seen multiple people recovering within 3 to 4 days and having a fever. So I think that has also added to the feeling that COVID is not affecting Pakistanis as much as it is affecting rest of the world. So, so it sometimes justifies the position that the Prime Minister might have taken. So the people get very casual. I'm in the north. I'm in Atashisha right now. So I see people going and praying in the mosque. So if I tell them, Uncle, why aren't you wearing a mask? And he says, no, it's not going to affect us. That's the simple answer.
Thank you.
So what government can do is on the regulation side and holding media conferences, but as Sadaf has already deliberated on how these media conferences are held, I don't see.
My second, thank you, Humaira. So my second question, the same question that your second panelist, Sadaf, quickly, if you could tell, what are those concrete steps that the government should take to curb the spread of such fake news?
So in terms of concrete spread, I think the first thing should be for the government to sit down and put in writing what they want to say. There has to be consistency in messaging. And it's really basic. Like, we are a very small organization. We are like 5 years old. But when we go out on a campaign and when we have to say something, we have a style guide, we have the key messages, and that's how even small organizations operate. So imagine a situation that's as critical as COVID. It's a pandemic, it has got the world on its knees, and there is nothing consistent about the messages that are being put forward. So in terms of bringing in country, a policy, communications policy, what are you going to say? How are you going to say it? Appointment of people who are authorized to speak on this issue. So whenever there's something sensitive, the government always, like, if it was an issue of security, a national security, for example, we will know who's authorized to talk to the media and who's not. But in COVID, we don't see the same seriousness. So what are you going to say? How are you going to say it? If there is confusion, and obviously it's a developing story, then how are you going to address it so that it translates, it's communicated to the public without giving an impression that the government itself doesn't know what it's doing. So on one side, there is this. On the second side, obviously, this is something on which you need to have multiple information sources. So, like, having small consultations with different civil society sectors, with technology, with Facebook, for example. I know the government is working very closely with Facebook, but who is dictating that agenda? Who is dictating how that should be operationalized? Is the government itself right now aware enough to operationalize that agenda? अगर आप UN पे देखें, there's the internet and digital technologies. Basically, the governance is discussed at the internet governance forums every year. And there, for the last 10 years, multi-stakeholderism within internet governance has been the key agenda, which means a different kind of legislation where only the government doesn't take power, but the technology companies, the private sector, the civil society, the academia, and the technology companies themselves, your corporates and global corporates, they all come together and try to find a cohesive solution. This is the approach that's largely missing. So moving towards that approach, including different kinds of experts in the narrative, and then building a narrative that is cohesive, coherent, true, but not misleading. I think that's
so coming with a strategy. Don't go just without any strategy. Coming with a strategy is the solution you're proposing. Thank you. So the next question is another interesting one. In different sessions, this is by Marta Halima, and in a different session I attended the other day, they were arguing that we all have a responsibility to speak out more proactively, as you also have said, when we see fake news being circulated by family and friends, as was earlier said, that not just building a narrative, but building a proactive narrative, as Dr. Taj said. So in places where the COVID debate has become so highly criticized and at times, even becomes violent, how much can we expect from the people to do so? How do the masses, become proactive? Dr. Schirch, would you like to please answer this?
Yes, I'd love to answer that one, because I think the pattern for most of civil society is they may see hate speech or disinformation or just misinformation online, and they are silent bystanders. They don't want to be involved in a conflict. They don't know how to interact with it, so they just watch it and ignore. The research on how we debunk rumors online is that if something is not getting any engagement, we ignore it. If it's a piece of fake news, but there's no likes on it, there's no comments, it's not going to go further. But if we see a friend, a relative post something and lots of people commenting and sharing, we have an responsibility to be upstanders, not bystanders, but upstanders, to post a link to an official health site which debunks the information that they're sharing and provides a site for real information. We'll take care of.
Is also a question that one of the persons have asked, that then the stance of these agencies has also changed quite radically over time, you know. So at one point, WHO would say that this is doable, this is not. At one point, we saw it is airborne. Then the University of Oxford or Imperial College published it's more airborne when in an indoor environment. Then someone said it's more airborne to 35 and 40 meters. So since the information was changing so quickly, it becomes very difficult of what should the masses hold on to.
Well, that's a very good question. And this is really an issue for the World Health Organization and the health leadership of the world. They've lost credibility. People have, you know, it's been extremists who've been attacking their credibility as well. But yeah, I mean, I'm not sure how to answer that. I think it's one of the problems is that the government does not have a strategic communication plan. There is no central source. There's not a set of talking points. And that's one of the reasons why disinformation is sharing so quickly.
Yeah, we have another question. This is also for Dr. Schirch. This is from Kamar Jafri, PhD candidate in peace building from Australia. The question is, can you share some digital peace building initiatives from USA that have been addressing the digital conflict coming due to COVID-19?
Unfortunately, the peace building community in the United States is not really working on this. We have some plans coming up to the election, but I don't believe there are any efforts, at least from the peace building community, to deal with this. I'm on a lot of calls with other researchers, but it's not our community.
All right. Another question is from Ahmed Sultan. Please shed some light that how government can engage communities in localized awareness campaigns to counter fake news. A similar question, and I would like Fasi if you could answer this. A similar question to this was that since we have an over-reliance on systems where we ignore a bigger part of the problem, which is ourselves, and then how this over-reliance of logical solutions, which prove themselves to be so ineffective, right? How do we overcome that? And then another question on the same lines for this, how do we engage communities for localized awareness campaigns, is that not everyone is online, and there are many aspects in terms of the rural community and also the influence of influencers, and the term here in the question has been used as illiterate influencers that have a mass following using different social media platforms. Fasi.
So I think number one, for local information campaigns, the biggest thing that could have worked is something that the state has purposefully avoided, which is local government elections. When we have local government elections, we have the possibility of going down into the districts and doing things that can be done in a way that no central or provincial government can replicate. And that is something that was essential and that has not been done, and we are seeing the effects of that. There are other ways of doing it. You could do it through the DC offices or through the MPAs, but it's not a perfect substitute for local government. Second, in terms of, I find, okay, this is anecdotal and I do not have research behind this, but I think pushing the onus of coronavirus fake news on the illiterates is probably a stretch, because we see it most from the urban middle class. We see, you know, conspiracy theories translate in different ways in different places. So, for example, if you look at polio vaccinations in Pakistan, the poorest of the poor are the ones who don't want them. But in the US, it is actually highly educated middle class people who have a small movement against vaccinations. So I just think that this idea that somehow it's the illiterate that's pushing this out is not factually grounded, at least anecdotally from my own perspective. It is, you know, educated, middle class, upper class people who have been perpetuating this. And I also find that the ecosystem of conspiracy theories, at least for 10, 15 years, has not been primarily locally generated in Pakistan. So if you read a lot of this emerging men's rights stuff, this is stuff that we've taken from the US. Some of the anti-Semitic stuff is also stuff that you can take from Western sources, that things like the Protocols of the Elders of Zion. These are things that we didn't create here. But now, because of this system, we're finding that we are appropriating and regurgitating them in our own way. So I just think that one, the ecosystem isn't closed, and I think the problem is probably, again, there was a Kenyan survey which was really interested on hate speech, and it's something that Dr. Schirch also mentioned, is that the vast majority of hate speech in Kenya, for example, during the elections, was done by people with no followers. So effectively, it had no impact. The only hate speech that really mattered was dangerous speech. It was anybody who had a real pulpit, who already had followers. And I think in some ways that putting the onus on everyday people is less important as it is on the government making sure that the biggest sources of disinformation, which include legislators in their own party, in the opposition, and in the religious element, are controlled.
Thank you, Fasi. Very well pointed out. Dr. Taj, there are some questions which I believe you have the best answer to. And there is one that what are some of the technological solutions to avoid the spreading of fake news on social media? I believe, in terms of its societal effects. The other one is that the government may control social media regarding conspiracy theories, but how is the spread of information through the local culture? In our culture, for example, is the spreading of the fake news through local jargas, local gatherings, or hujras could be controlled, including the gatherings in the mosque, because they all serve as communal spaces at the end of the day. And we've seen a bit of a rise where such cultures exist as well in the very early days when the testing was being done. So your views on this?
Okay, so on the first one on technology, I think there definitely has to be some conversations around the design of algorithms in that determine what information is presented to you. As I said, I mean, there is just, we think that the complex problem exists because either people don't know about something, they don't know what to do, or that's what they want to do. So in our general way of solving problem, the solutions that we have are always about, let's tell people, let's incentivize them, let's find them, where the underlying assumption is to somehow that's their motivation, that's what they want to do, and therefore we should try and do something about it. Like a lot of behavioral science tells us that yes, motivation might play a role, but the people around you and just the environment itself also plays a huge role. So for instance, how easy it is for me to share, even though I'm not motivated, will definitely have an influence of whether I would share or not. Right? I mean, that's just saying. Right? How often have you seen now? So this is being tested now about if in your email content there is something about, like, the AI figures out that either you sound angry, or you might be a little not your normal. It warns you, are you really sure you want to send this out? Right? What it is doing is technology trying to figure out something, and then it's one. Now this has nothing to do with motivation, but what it has to do is being timely. So as I said before, we have to move from debunking, we have to go to pre-bunking, which is right at the time when I'm about to share something, can I intervene? And I think that's where technology can definitely play a role. One, help us pause. We really want to share this. And of course, we have to try and have this active learning, perhaps part of curriculums, that it might have to go, yes, that's a more systematic, long-term kind of a thing, but technology's role will definitely be on that very moment. There are definitely, I'm pretty sure that there will be ways on intervention by these technology platforms. On the second point, I don't think that I would really have much knowledge about, specifically those jargons, how they would perpetuate. I think it would go back to just the general behavioral insight about, again, having a timely intervention, not overly relying on motivation. I think just generally, if we are trying to solve this problem, we should also think about the environment in which the behavior takes place.
All right. Thank you, Dr. Taj. We have lots of questions that were coming in. Unfortunately, because of time constraints, we can't take them all. Just to, if any panelists would like to add anything further to the questions that I have asked, please feel free to do so, whether you would like to contribute to the local JICA and the gatherings and communal spaces part. Okay. And we have stretched beyond the time that we promised, so my apologies. But thank you so much. It's been a wonderful session. I believe a lot can be talked about, a lot of things that I learned today. I'll quickly sum up for everyone that what so far we've discussed. So while we discussed lots of nuances where it stems from, why is it? So when we only focus today mostly on COVID and how different opportunist groups, political, religious, sectoral, who want to create those differences, take advantage of such situations and spread fake news, going for further polarization. Pakistan is a victim of it, so are many other countries. We heard some other examples as well. So the solutions that so far were shared, and I'm summing it up, one was communicate from the government side. So more communication and open communication and a proper comms strategy by the government so that you know what exactly is the tone you have to build. And then the mass awareness campaigns, which was good for the religious part of the society which is not very much connected online, and those who are not young but still are falling prey to such fake news. So mass awareness campaigns on not what COVID is, but on how not to spread fake news, on how to identify this is fake. But this has not been done by the government, so I believe good area for development sector to come and work on also running mass awareness campaigns on identifying and not sharing fake news. A great piece was shared by Dr. Taj on pre-bunking instead of debunking, or in more proactive approach, proactive narratives rather than reacting and building a counter narrative. Then it was no fast or no knee-jerk reactions. Give a pause before you share anything. Many of you asked what to do, and Dr. Taj explains how the burnt brain works, and quick reactions often result in sharing without verifying. And the other one was the social currency element, which is very, very important. And people looking up to their peers, their leaders, that they can relate to and they follow them. So perhaps using more influencers from the religious side, from sectarian side, and our political leaders, when they set the tone right, people do follow. This is something which Facebook and the likes started curbing through third-party fact checkers. Organizations were hired who point out that some news is not accurate, and then the algorithm starts taking it down in your news feed. It doesn't show up, but that is not enough, and we've seen how this has worked for around the world. Great developing topic. I believe a lot of work can be done. So once again, thank you so much to the great panelists and to the audience for staying so far and for making it such an interesting discussion. This is it. This is a wrap for us. And we hope that we get in touch again with you to see what can be those action items and what are those steps to curb the spread of fake news.